il ruolo del macrofago nelle patologie reumatiche. Questo è il tema di un'interessante relazione svolta dalla professoressa Lebre nell'ambito dell'ultimo congresso Magenta Osteoarea. Dr. Lebre, which is the role of macrophages in rheumatoid arthritis? Could you please explain to us?
Well, macrophages are one of the most important cells in rheumatoid arthritis because they produce one of the targets therapy, which is TNF-alpha. And this TNF-alpha is very important for the inflammation that is seen in rheumatoid arthritis.
Which data do you have to support this relationship?
Well, we have some data, especially in terms that when we block, for instance, B-cell therapies or with anti-TNF-alpha, and with the other type of therapies, there is a reduction of macrophage numbers, and which is associated with a decrease of disease activity.
So there is a strong relationship between the biological drugs activities and the macrophages level. It is correct?
Yeah, it is correct. So actually we can use macrophage as a biomarker for effectiveness of the therapy.
And did you make some studies in your own laboratory about that?
Yes, some colleagues of mine, they've done really elegant studies in which they look at the macrophages that are infiltrating the synovium, and we have shown that for instance, blocking of TNF-alpha, that doesn't block the influx of monocytes into the synovial tissue, but mainly we think that it will be mainly a retention or induced efflux of macrophages from the synovial tissue.
This knowledge, how could help the physician in making more effective treatment, and why?
Well, I think with the data that we have shown, especially with adalimumab, it's important to know that this drug does not block the migration of monocytes into the synovium, but instead there is retention. There is less retention of the macrophage in synovial tissue, and probably more efflux of macrophages from the synovium. So I think that it's quite interesting to speculate that maybe we should look for targets that block the retention of macrophages in the synovium and not the migration into the synovial tissue.